The risk from that patient that's being treated here is said to be low, but doctors are so concerned because they still don't know how she got the virus. The CDC has said all along this is a rapidly evolving situation, and that is certainly the case tonight.
Seriously ill and on a ventilator, the newly diagnosed coronavirus patient remains in isolation here at the UC Davis Medical Center, perhaps the first U.S. case of community spread of the virus. It means doctors don't know how or where the unidentified woman got sick, since she had no travel to China or known exposure to someone with the virus.
What that indicates to me is that this virus is circulating in the community. And there are probably other cases. This is probably the tip of the iceberg.
With 60 confirmed cases of coronavirus in the U.S., doctors at UC Davis say their patient was transferred here February 19th with a suspected viral infection. But testing was delayed because the patient didn't initially fit CDC testing guidelines. 4 days later, the CDC did order testing, the results coming back positive a week after the patient arrived at the hospital. Now medical staff who came into contact with the patient have been told to self-quarantine.
This case that we're discussing today marks a turning point. And as such, we're expanding our surveillance activities.
As state and federal agencies work to broaden access to testing, doctors may never know how the patient at UC Davis Medical Center became ill. It comes amid a new whistleblower complaint from a federal employee alleging workers didn't receive adequate training or protective gear when they treated hundreds who were quarantined at nearby Travis Air Force Base, raising concerns those employees could have exposed the public when they left the base. In California alone, more than 8,400 people traveling back from regions near the virus's epicenter are being monitored by health officials.
There's probably other patients who are getting this disease, who are more mildly affected, who have not come to medical attention, and that means that everybody in the community is at risk.
Tonight, the virus spreading, as is worry that the public could be at greater risk. Miguel Almaguer, NBC News, Sacramento.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.